call the speed round of this panel discussion. This is going to be quizzing our medical team, right, to present to us the facts. And we have one of the best guys at doing that. You know, he has hosted his platforms. And so we're going to turn over this segment here to Mr. Corey Caton to discuss the fear factors, the myths, and the rumors as he throws out some questions based on different categories. Mr. Caton, it's all yours. Take it away.
How you doing, guys? Good night to everybody. Appreciate everybody for joining. Thank you, Ms. Yvette Clark. And we're going to take it right away. Now, these set of questions here, anybody in the medical field could jump in and answer them. So, you know, don't hesitate to jump in. And the first question is, how is SARS transmitted? Anybody in the medical field could jump in.
Transmitted mostly by people breathing the germs out and then other people breathing them in. There's a little bit of transmission, but not a lot from, you know, not washing your hands and stuff like that.
Okay, good. Thank you. Next question. What is the incubation period for COVID-19?
Don't speak at once. Come on, this is a real.
I'm sorry, I was muted. It's about 7 to 10 days for the incubation. Most viruses, usually within 12 days, you know if you're infected.
Okay.
I'll just add, after an exposure, you can test positive as early as 3 to 5 days.
Okay.
Okay. What are some of the COVID variants?
There are many. There are numerous. Many of the variants have been, they've developed various different nomenclatures. At first there was numbers, then it was by the place where they were identified, be it New York or the UK, but now they're using the Greek alphabet. So there's, you know, folks have heard of Lambda, folks have heard of Mu, but there's subpopulations as well. So there's a lot of different variants, subvariants that have been identified.
Yeah, and variants usually occur either at the death of the host cell or the host individual. So this is the whole concept of a swarm, and it leads into a whole lot of other ideas of the virus itself mutating, multiplying itself, and so on. So just like naming them, good luck keeping up with naming them. We need to fix the problem.
Next question. What is the natural history of COVID?
I think researchers
for
are
most
still...
infections is you get some kind of level of sick and you get better. That's most people. And if that was everybody, we'd be great. Unfortunately, some people die and some people get very sick. And Dr. Parsons and I got some people we're tracking who've been in a nursing home for months and months. I don't know if they'll be better in 2 years, but they've been sick a long time.
Okay. What factors are associated with severe COVID-19?
Could you clarify?
If you're asking like what puts you at risk for more severe COVID, it's hard to tell because frankly, you know, there are perfectly fine people who are, you know, athletes, marathon runners that can die of COVID, and then people who have never really cared that much about their health who get COVID and do fine. So there's no absolute answer to that question, but we do know that there are some factors that predispose you. So COVID in general wreaks havoc on your lungs. So if you have any kind of underlying lung disease, if you have asthma, if you're a smoker, if you have emphysema or COPD, you are at much higher risk of having a bad outcome from COVID. Also, there are other things that, for reasons we don't totally understand, can also predispose you. So it's things like obesity. If you have diabetes, for instance, you are at higher risk of having a worse outcome from COVID. And then obviously, if you have any kind of issue with your immune status, if you are HIV positive, or if you have an immune deficiency of whatever sort, you may fare less well than others. But again, those don't always hold true in a single individual, but those things that I just mentioned generally hold true across populations. But everybody here is going to know somebody that was extremely healthy and died of COVID, and they're going to know somebody extremely not healthy who had COVID and was fine. But for the most part, it's the opposite. Those who have underlying issues don't do well with COVID. Those who have not been vaccinated, generally, if the statistic I always keep in mind, 97% of people who are in the hospital right now with COVID are unvaccinated. To me, that tells me a lot of everything I need to know about why I personally would vaccinate myself, my family, and my children. But for the most part, 97% of people who are right now really suffering with COVID are unvaccinated. But there are many other things that come into play, and it's very hard to predict. But on a whole, the things that I mentioned are how the public health thinks about it.
Okay, great. Thank you. What are the major cardiac complications in patients with COVID, and how often does it happen?
Well,
Go ahead. Go ahead.
The cardiac issues is related to pretty much the lung itself, as Dr. Parsons was saying. Hello, Doc. The lungs being first compromised. So when the virus attaches itself to the silica cell tissues of the lung, then it in turns reduces the ability to oxygenate the blood that goes to the heart. And so I think that's the real starting point, looking at where it happens in the lung and then how it in turn happens in the heart, and maybe eventually how it may also cause blood clotting down the road.
Sorry,
Okay,
guys.
great.
Did I answer your
What
question?
is, yes, you did. Sorry. What is long COVID?
That's a great question. So long COVID is the word that we've been using to describe the long-lasting effects of COVID. So many people, a lot of people get COVID. They suffer for a little bit, couple days, maybe they don't feel so good. They have like an upper respiratory infection, like looking illness, fever, cough, and they get better. But there are quite a few people in whom the symptoms don't go away. They continue to have long-lasting sequelae of their COVID infection. And that's what right now, with lack of a better term for it, we're just calling it long COVID, meaning you're suffering from COVID longer than most people. And there are actually centers of excellence that are being put together. There are some, for instance, at Health and Hospital that are a team of specialists that are banding together. They bring together, pulmonologists and cardiologists and neurologists together who can follow the symptoms of people who have had COVID and who have long-lasting effects. We still have a lot to learn about the long-lasting effects of this virus. We don't know yet. I think a lot of people focus on, well, we don't know a lot about this vaccine. But at the end of the day, 4 billion people in the world have gotten this vaccine. There are a lot of people have gotten this vaccine. And sure, we don't know everything, but I can tell you something, we don't know a lot about COVID, right? We don't know what the long-term impacts of COVID are. And I always worry when people fear the vaccine more than the disease itself, because for the most part, we understand vaccines and we understand the body's immune response. It is very, it's new for us, this COVID infection. We don't know what the long-term impacts are and how they will vary from person to person.
I did want to just add You know, what we have learned about this long COVID is up to 1 in 5 or 1 out of every 3 people who gets COVID had some of these long-term effects. And it's not just shortness of breath or difficulty walking upstairs. People are having, you know, neurological symptoms, confusion. People are living with debilitating, you know, other kind of neurological symptoms like lower leg issues and other things. So we're just seeing that it's also affecting children long-term. And just to highlight some of the limits of our system, the healthcare system does not do well with someone with vague symptoms that are hard to define, that are hard to describe. We don't do that well, especially when it comes to pain and other things. And with this long COVID, I think that we could potentially see another kind of public health crisis where we have millions of people who are having these symptoms, these vague symptoms that can present in ways that people aren't familiar with, and people it's going to affect their lives, and they're not able to actually get treatment or identify what's going on, and that can cause another major crisis. When we're thinking up to 1 in 3 people who've gotten COVID, that's a lot. And so, yeah, just wanted to highlight that it's a really big problem.
Okay, great addition. Thank you for that. After somebody is affected with COVID, how long should they stay isolated?
I think the general guidelines are like 7 to 10 days of, you know, of making sure that and then being at least like 3 days symptoms free. It sort of depends on who, you know, to me, I think if you're taking care of like little neonatal babies, you should stay home a little bit longer. If you're working, you know, in isolation by yourself, remote from home, you know, you can get back at it a little sooner. But in general, we say, you know, make sure it's about at least 7 to 10 days with at least 3 days being symptoms free.
Okay, great. When is the best time to get tested after COVID exposure?
To get tested for what, Corey?
Get tested for COVID-19 after you've been exposed to it.
And you won't know if you've been exposed unless you're experiencing some kind of symptoms. So like really in terms of testing, you know, just on a safe side, you might want to just do testing anyway. Like because we're in the middle of a pandemic. Like somebody who may not be anxious or question the vaccine may certainly still feel safe enough to do testing. And that at least gives you an advantage before infection.
I'll just add, so we can contact the virus through community spread for someone you don't know, but if you are a known contact, if someone you are around in a close vicinity within 6 feet, mask off, test positive, that's a higher risk, a known exposure to someone who you definitely were around. So if that occurs, we recommend that folks do get a test 3 to 5 days after, and actually to kind of try to physically distance, make sure you're wearing a mask between the time you get your test and your result, so that you don't inadvertently, you know, expose other folks while you wait for the test.
Well, that again, for those who take public transportation, New York City, if you get on a train during rush hour, you just look around on the train. I'm not talking about people in the comfort of their car. Look around on the train. All right.
No, but
we have mental health. We have homelessness / mental health. We have a lot of people that just feel confident that they've had the shot, they can take their mask off. It is a greater level of exposure just in the subway system itself that we're not even having a conversation about. And I really won't even get into Mayor de Blasio's foolishness with all of these mandates, because if he really wanted to save the city, then he would do something with the budget and the monies that he have to actually provide other means of transportation other than packing everybody into these sardine type cans of trains where they can actually be exposed and keep this thing going, and variants keep on mutating. That's the society that we are living in, and it's being fed by these legislative bodies that are making decisions regarding how we should live in terms of whether we're able to work, whether we're able to go out and eat, and all of these other things. This is serious. We all know it's killing people, but how we are going about preventing the killing is the deaths of millions of people and children, especially, is very terrible. It's very poor.
I would like to, yeah, I would like to make a comment back to when you test. Some people, when they find out that they were exposed to the virus, they quickly test. But you have to balance the testing against the incubation period. Because if you run in and you test and you do it, say 3 days or 2 days, and you're negative, I don't want people in the audience here to think that you then take a false sense of security. Oh, I'm negative, not bearing in mind that you have to work with the incubation period. So please be mindful of the fact that if you are negative on day 3, it does not mean that you are not still at risk for coming out positive with the virus.
I agree with you. Thank you. I totally agree.
Thank
Carl,
you so much.
may I
Oh,
ask
somebody
you a
else?
question?
Okay.
Yes, please. If someone has epilepsy or seizures, can they take the vaccine? And would anyone recommend, of the 3 or 4 vaccines, AstraZeneca, Johnson & Johnson, Pfizer or Moderna, someone who gets, regular seizures and also who have, or another person who may have epilepsy, would you recommend that they take any of these vaccines? And if yes, which one?
So Lexi,
That's
hold
part.
on. Lexi, hold on one second. So the rules were that only the panelists could rebut in the subject.
Oh, okay.
So
I joined in
so-
late, so I didn't know.
Yeah,
Sorry.
so if you have a question like that, you could drop it into the chat, and then we'll look at it during our Q&A period downstream. All right.
I would just say, just to answer or to assuage Lexi's concerns, there aren't any specific concerns or warnings related to people who have epilepsy or seizures with respect to COVID. And so they should get the vaccine that they feel is right for them. It's worth, if they want, they can talk to their doctor. The Moderna and the Pfizer vaccines in general have the highest efficacy. And I think Moderna is, at least from what we know right now, and all of this changes, as we come to learn more, but Moderna looks like it has, after the second dose, compared to the second dose of Pfizer, compared to 1 dose of J&J, Moderna appears to have the longest lasting impact. But at the end of the day, there is no special consideration that needs to be made for somebody who has epilepsy or seizures. I think the most important thing is pick a vaccine and get vaccinated in order to protect your health.
All right, thank you.
Okay.
Hey, Corey, we
Thank you
got
so
one
much.
more. We got 1 minute or 2 minutes left to.
All right, I'll ask one more question. What are the different type of ways to get tested for COVID-19?
A rapid test that's pretty good and not terribly expensive. And now you can buy some of them on your own in the drugstore. And then there's the better test, which is going to pick up more cases, usually the milder cases that aren't shedding as many viruses. That test is much more expensive and takes longer to do. It's called the PCR test. So it depends, it's like everything else. What are you going to do with it? If you need to know right away, you go with the fast test and make your best guess. If you got plenty of time and plenty of money, then you get the other one.
Okay. So
I will add that cost should not be a major barrier. There's free COVID testing at city-run sites where they can actually do rapid tests, and they also are able to rapidly process the PCR test, which is a more sensitive and specific confirmatory test, which was typically what people think the swab that kind of goes up higher up your nose. But there's there are various different ways that you can actually test via lower nose swabs, oral swabs, spit test. There's a lot of different things that are available. But in general, there's like an antigen test, and then there's, you know, and then there's also antibody testing to see if you were exposed, and then there's a PCR test.
Yeah.
All right.